If you've been putting off appointments because of the pandemic, our next guest says you shouldn't do that. It's important to your overall health, especially to your eyes. Joining us this morning is Dr. Andrew Rabinowitz. He's the Chief Medical Officer at Barnet Dulaney Eye Center. It's good to see you, Doctor. I want to talk a little bit this morning about glaucoma. I've heard of it. I'm not exactly sure what it is.
Sure. Glaucoma is a condition where the nerve in the eye, the nerve that connects the eye to the brain, that sends information that we see in our eye to the brain where we process the image, that nerve is damaged, and it's damaged because of an accumulation of pressure or fluid in the eye. And that accumulation of fluid has no symptoms, so patients have no awareness that they have the risk.
Oh, okay, which makes it even more important to make sure you get that eye exam. Is this something, so you don't necessarily feel it, you don't feel pressure, you don't feel any of the symptoms, it's only discovered through an exam?
That's correct. So 50% of people in the United States right now that have glaucoma have no awareness that they have it. So it's not something you feel symptoms of. It is asymptomatic.
Is it hereditary?
It has a significant hereditary component to it. So yes, it is definitely hereditary. And if you have a family member, parent or grandparent, you have a significantly higher risk of developing it as you move through life.
Wow. Okay. Very important to know. Let's talk about let's say you come in for an eye exam and we discover that there is a problem. This is something that requires continued treatment. And this is what you do.
Correct.
You will find it and treat it as well.
Correct. So it is a preventable condition, meaning the earlier we catch it, the better our ability to help protect sight. And when someone has glaucoma caught early, we can ensure them that they can live the entirety of their life, whether it's 30, 40, or 60 more years, and we can prevent them from losing any sight. So it is a preventable condition with excellent, tried and true treatments. Yeah. There is never a case where we say, sorry, Mrs. Jones, we can't help you. So it is preventable and treatable.
Okay, so without exams, this is something that could damage your eyesight long term, is that right?
Absolutely.
Are you finding that there are a lot of people who are avoiding coming into the office to get their eye exams now because they're afraid? And if so, what are you doing to make sure that they're safe and stay safe?
It's very understandable where there's tremendous amount of anxiety around leaving their homes, going to a doctor's office where there's a number of patients. So what we do is we make sure that the patients have the safest possible experience. We have temperature screening at the front door. We have masks on everybody, that is every patient, every staff, every nurse, every doctor. We sanitize every room between every patient. We do a terminal clean of the office every night. A terminal clean is something like we typically do in an operating room where you put cleaning chemicals on the surfaces, but unlike a regular clean where you put them on and wipe them off, a terminal clean leaves those chemicals on the surface for anywhere from 5 to 10 minutes to be sure to kill all microbes. So we're creating an ultra safe environment for everybody.
So you are keeping us safe all the way around. And again, it is so critically important that you go in. Don't avoid coming in because your eye health is imperative to your overall health. You can see so many things. Dr. Rabinowitz, thank you so much. Good information. Really good to know, and I want to give our viewers some more information. Barnet Dulaney Perkins Eye Center, they have locations all across Arizona. You can call 602-313-0804 or find one near you. Visit the website goodeyes.com.